If you have experienced a miscarriage or know someone who has, this video is for you. Before I start, I want to make this clear to us that miscarriage does not happen as a result of what a woman did or what she did not do. Miscarriage is one of the most common but least talked about experiences in pregnancy. Most women go to the hospital and come back with unanswered questions, and they are left with guilt they are not supposed to carry. In this video, I will explain what a miscarriage is, the types of miscarriage, the causes, the signs and symptoms, the prevention, and I have a message every woman needs to hear. The most common cause of miscarriage is chromosomal abnormalities. Research shows that about 50% of miscarriages happen as a result of chromosomal abnormalities. This means that the baby had a missing or extra chromosomes. The pregnancy could not develop normally, and there was nothing anybody could do to help this or to stop this. Even in normal pregnancies, in healthy women, in planned pregnancies, this can happen randomly. Some miscarriages are linked to maternal health conditions such as uncontrolled diabetes, high blood pressure, thyroid disorders, autoimmune conditions like lupus, severe maternal infections like TORCH, which stands for toxoplasmosis, other agents like HIV, varicella, rubella, cytomegalovirus, and herpes. This is why prenatal care is important, not because you caused the miscarriage, but early care, early antenatal care can help to reduce risk. Sometimes miscarriage is related to uterine conditions like fibroids, cervical incompetency. And the worst part of it is that some women don't even know that these conditions exist till after a pregnancy loss. Again, this is not something you call risk factors of miscarriage. There are things that raise the chance of having a miscarriage. One is advanced maternal age. Studies have shown that women above 35 are at higher risk of having miscarriage than women in their 20s. Two, long-term conditions like diabetes, hypertension, thyroid disorders. Three, being overweight or underweight. Four, lifestyle factors like smoking, alcohol use, illicit drug use, excessive caffeine intake. And five, past history of miscarriages. Types of miscarriage. One, threatened miscarriage. In this type of miscarriage, there is bleeding or cramping, but the cervical os is still closed, and there is evidence of continued fetal movement. Two, inevitable miscarriage. In this type of miscarriage, there is bleeding and the cervical os has opened, but there is no passage of any fetal part. But since the os is opened, that is the canal through which the baby passes out, it is certain that the baby will still go. 3. Incomplete miscarriage. In incomplete miscarriage, there is bleeding and the cervical os is also open. There is passage of some of the fetal parts. Complete miscarriage. In complete miscarriage, everything has passed, both the baby and the placenta. 5. Missed miscarriage. In missed miscarriage, the fetus is dead. So the best thing to do is to evacuate it. There's no need keeping a dead fetus. 6. recurrent miscarriage. This is a situation whereby the woman has had three or more back to back miscarriages. What does not cause miscarriage? In this section, listen very carefully. Let's clear this up. Miscarriage is not caused by stress alone. Walking, exercising normally, lifting light objects, having sex, or your feelings or emotions do not cause miscarriage. Please release that guilt. There are things you can see that will be suspicious of miscarriage. So let's look at the symptoms of a miscarriage. One, bleeding, which could be light or heavy, with or without a pain. Two, pain or cramping in the pelvic area or lower back. Three, passage of fluid or tissue from the vagina. Four, decrease in the early signs and symptoms of pregnancy you were feeling. Prevention of miscarriage. Remember, I told you it's not your fault, but there are things you can do to help yourself. Number one on the list is early and regular prenatal care. Two, please stay away from alcohol, smoking, illicit drug use, and excessive caffeine intake. Three, healthy diet. Four, take your daily prenatal multivitamins. Five, if you have any medical conditions like HIV, diabetes, hypertension, and other conditions, please register early with your doctor, OBGYN, your GP, your midwife, so that they will create a treatment plan for you. Six, studies have shown that low dose of aspirin in women who are trying to conceive help to reduce the risk of miscarriage. Miscarriage is not just a physical loss, it is emotional. You may feel sad, angry, guilty, numb, or isolated. All of these feelings are valid. But remember, healing does not mean forgetting, and grief does not have a timeline. If this video helped you to understand miscarriage a little better, feel free to like, share with someone who may need support or comfort at this time. And don't fail to subscribe to Maternal Health Matters for more trusted and compassionate education. Also leave your comment in the comment section. We appreciate you. See you in my next video.